We're back with Christine Brannock from Cone Health's Oncology Outreach Center. She's talking about skin cancer and how you can kind of get ahead of any major issues. So let's talk about this. What signs do people need to watch out for when it's time to go see a doctor? Or should everybody be going to see somebody?
So it's important to check your skin to know what's normal for you. And when we're looking for signs and symptoms of melanoma, we look at what we call the ABCDEs. So the A is the asymmetry. So a mole's typically going to be a perfect circle, perfectly around. But if we're seeing that one side is larger than the other, the B stands for border. So if the border appears, again, the border should be perfectly round. But if it appears irregular or kind of jagged or notched, the C is the color of the mole. So typically a mole is going to be a shade of like a tan or brown. So if we see a mole that has some variations, maybe, some tan, black, brown, maybe red, or you can even be as simple as a little tiny dot in there. And then the D is the diameter of the mole. So typically a mole should be smaller than the size of a pencil eraser, which is around 1/4 of an inch. And then the E is evolving. Is this mole growing or changing over time? So if you were to notice any of those symptoms, it's important to let your physician know or to see a dermatologist.
All right, and so who do you call? I guess, do you have to start with your regular doctor? Can you call a dermatologist straight on?
You can either one, whatever you're more comfortable with.
Okay, and so when we talk about that, like, do we go and look for screenings, or do we say that we need to just have a regular checkup?
It is important to have a yearly skin cancer screening by your provider, whether it is at your regular doctor or a dermatologist.
Okay, and Cone Health has a mobile cancer screening unit from what I know. So what screenings are offered on that, and how can someone find out if they can be part of that?
So the mobile cancer screening unit, we offer mammography, we offer prostate screenings, and we offer colorectal screenings, the FIT test. We do have skin cancer screening coming up on Monday, June the 6th at Alamance Regional Cancer Center.
Okay, and let's talk about just the importance of early detection when it comes to skin cancer.
Yes, so it's important to pay attention for those ABCDs. Some other things, there also is the basal and squamous cell carcinomas. So you want to look for things like a sore that doesn't heal. Typically, if you were to have a sore, it's going to heal within a week or two. But if you see that it keeps bleeding and crusting over, if you see a growth, like sometimes a wart-like growth that's not getting better when you're trying over-the-counter treatments. And they can be a lot of variation. So if you see something, it can be just, a red patchy area of skin that you're seeing is getting worse. And these are all important things to share with your doctor to have them checked.
Yeah, don't leave them off. This is now the time to go to the doctor when you see that stuff. I wanted to go back to, I remember you telling us putting the sunscreen on places that we don't normally think about, like the ears or the scalp or the hands or the feet. What about our lips?
Yeah, so it is important, too, to find a chapstick that has sunscreen in it, because even our lips can get sunburnt. And also sunglasses are very important because sun exposure over time can cause macular degeneration or cataracts. And we also need to make sure we're picking out our sunglasses and our sunscreens that we're finding that they protect against both UVA and UVB rays. So we kind of look at those the UVA rays are those aging rays, and those UVB rays are those burning rays. So we want to protect our skin both from aging and from burning.
Yeah, and usually the sunglasses have like that little sticker on it that says UVA and UVB on it.
Yeah, and it's really important to look for a pair that does have that.
Okay, all right, for all of us. All right, so we've been talking about skin cancer, how to go about going to the doctor, what you should be looking for. If you missed any of this, what we want you to do is we want you to go to our website, because we're going to post all of this information so that you have this resource all of the time. It's WFNYnews2.com.